Frontotemporal degeneration. It's the most common form of dementia for people under age 60. It has no cure, no treatments available to slow or stop the progression of the disease. In this Being Well special on FTD, Love Needs No Words, we'll learn more about this condition from a family member, as well as a medical professional's point of view. And we'll share the important steps you can take to preserve and maximize quality of life if you or a loved one faces this serious diagnosis.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this Being Well special on frontotemporal degeneration. I'm your host, Lacey Spence, and this evening we're welcoming in our first guest who is giving purpose to their pain. They are an AFTD ambassador, but first they're a mother. We welcome to this episode, we've got Dawn Kirby here in the studio with us. Dawn, thank you so much for joining us for this special and highlighting a condition that really needs the spotlight.
Well, thank you, Lacey. I appreciate the opportunity. It's not something that I would have signed up for, but since we were on this journey, I think it's so important to pay it forward and help others because I was sure helped by those that were working with the AFTD. So I appreciate this opportunity.
Of course. And so as we start talking about this topic, your lovely daughter, Kara, she was diagnosed with a specific type of FTD. Can you give us a little bit of what signs or symptoms did she kind of start presenting that made you concerned?
Well, you know, I personally had never heard of FTD. She ended up having what they call behavioral variant frontotemporal dementia, which is the most common form of FTD. And in the year of 2017, she was pregnant. She had gone through in vitro, you know, which is a very stressful time, and everyone's emotions are running high. And that summer, my niece, which was Kara's baby cousin, her youngest cousin, was killed in a car wreck in June, just 6 weeks before she had the baby. But Kara was very withdrawn and maybe not really characteristic of how we would have thought she would have responded. You know, she kind of became a little more withdrawn instead of being with the family, but she was going to have a baby and she was trying to be protective. And then she had the baby July 27th, and then 3 days later, her favorite grandpa passed away the night before she was bringing the baby to meet him. This was devastating for her, and so it's kind of like, I call it the perfect storm, you know, because postpartum depression was the first diagnosis, and everything kind of fit, you know, especially with the trauma and having a new baby. So as time went on, she became very OCD. Actually, by the time he was about 4 months old, she was having like auditory hallucinations, and I knew this was not your typical postpartum. And that's when I started seeking further treatment and took her to a psychiatrist and looked into, you know, more of treating maybe more of a psychosis type thing.
So overall, how long did it end up taking to get a diagnosis? I mean, like you're saying, it's presenting as all these other things. So if you're not even, for sure looking in the right spot, it's got to be difficult.
Yes, and that's one of the hardest part with frontotemporal dementia or degeneration versus your Alzheimer's or other forms of dementia, because a lot of times they present with memory issues, and usually in your older adults. Kara was 29 years old when she was diagnosed, so she was barely 27, 28 years old when this was all happening. And it wasn't on their radar. It wasn't on our radar. We didn't know it existed. And as she continued to do the, the typical therapies and medications for whether it be postpartum, depression, OCD, anxiety, even a psychosis, nothing was working. And it actually took over a year and a half. We had gone to actually a hospital in North Carolina. She spent 2.5 months in a perinatal psychiatric unit, and that was the summer of 2018. Ended up February of 2019 at Mayo Clinic in Rochester. And her doctor, Dr. John, is the one that sent us. And by that point, Dr. John said, I think we need to go to Mayo. It's kind of beyond us right now. Mm-hmm. And Dr. Beauvais, who is a specialist at Mayo, is the one that diagnosed her with behavioral variant frontotemporal degeneration.
And so once you got this diagnosis, I mean, how did you handle it?
Well, to be honest with you, that is kind of a double-sided question, because in one respect, the anger, the emotions that you're going through, like, why can't we figure out what's wrong with her? Why is Kara so different than she used to be? Because with your normal mental illnesses, the person can tell you, I am depressed, or they can they have some insight. Where with Kara, she had no insight of what was even happening to her. It's a big word called agnosia, where you have no self-awareness of your disease. And so, you're scared, you're worried, you're sad, you have all these emotions that have been going on for a year and a half, and you just don't know what's happening. And when you get your diagnosis, there's almost a form of relief, because someone believes you, first of all, that there's something more. Wow, we know what it is, because there's nothing worse, I say, than trying to tackle the monster under the bed or in the closet. If you don't know what you're dealing with, there's nothing worse, in my opinion, and we lived it. Once we had the diagnosis, actually Dr. Beauvais looked at me, and he was pretty emotional himself and said, I know this isn't what you came for. And I said, we were already living the nightmare. You just put a name to it, but now we can move forward and do the best we can with what has been given. And I think too, to be honest, I know there were people that probably thought I was overreacting and not sure, and I know there were. And all of a sudden it's like, okay, I'm not crazy. I knew this wasn't my daughter.
As a mom,
I'm telling you, as a mother, that instinct goes deep. And they say go with your gut. That's why I took her across, the country, basically. So it was extremely difficult. But then you face the challenge of bringing that to the family and friends and coming to grips with the prognosis, which is incurable.
And that's absolutely so very tough. And so moving forward from that, kind of tell us about maybe how long they were giving you with Kara. What types of changes continued to happen in her to give you new Kara?
Right. Well, that's what's that's what's so difficult about a lot of your dementias, and especially your frontotemporal degenerations, because a lot of people don't recognize them right away because they present as behavioral. So a lot of your people, the common age is like 45 to 65. So you have a lot of people that they think they're going through midlife crisis, they're going through, different types of maybe depression, anxiety. With Kara, because she was only 29, it was really difficult for people to understand why she was acting the way she was and the way things were happening. Yeah. And so, it was very difficult to kind of realize this is where we're at, and some people can live 2 years to 20 years with FTD. So they tell you this, and then they say, the average life expectancy after diagnosis is typically 7 to 8 years, where your Alzheimer's is more like 10 to 12 years. And so with Kara, it's just like with any disease, the younger you are, typically the more aggressive it is. And that came true with Kara. She lived 4 years after diagnosis. She began to really change quickly, becoming incontinent, both bowel and bladder. The last 2 years, she was totally mute, could not speak, could not smile, could not show pain. Just a few months, like September before, August, before she passed away on New Year's Day of 23, she fell and broke her arm, and we didn't know it for 2 days because she showed absolutely no expression. And it's really hard as a mom to think, that you miss something like that. Yeah. Sorry, it's a little emotional, but I realized I had to really come to grips with, this is the disease. This isn't something I control. This isn't something that Kara did or caused. And there's a lot of things that made it very difficult because she couldn't communicate. And not even with a smile or even a grimace. So we learned that love needs no words. That's what we call it. We did a lot, just the sign language of I love you was mainly. Pen. Yes, I have a pen, and it's something that I have a lot of people, it's kind of a conversation starter, and people are like, I love your pen, what does it represent? So Kara is actually helping others, because she was a nurse, and she's helping others even after her passing, and that's why I do this, is to bring purpose to her life.
No, absolutely. And with this being a condition that not many people have heard of, or is maybe more rare, do you know of anyone else in your purview that has had this condition start to present?
Yes, the one thing about the AFTD, which the Association of Frontotemporal Degeneration, is they have a Facebook private support group, and they have others also around the nation. But on Facebook, I met several other ladies who had children in their early 30s. Kara at the time was the youngest, but we called ourselves Sister Mama Bears because there was just a small group of us, but actually it's probably more common, unfortunately, because they're not being diagnosed. It's probably more rarely diagnosed versus rarely occurring. And that's why I'm very passionate about bringing this attention. But I have a dear friend, her name's Robin. Her son Justin, he passed away at 37. And I always ask, may I mention your child? And we're all very, very passionate about teaching other people. And I know a young lady named Jessica that had it. There's several. And there's people when they can empathize with you, you can gain a lot of strength. It's not a club we signed up for, but I'm very fortunate that whenever Kara was diagnosed, they had already been on the journey for about a year, and I gained a lot of strength and support and knowledge from them.
Mm-hmm. So as we've got a few, several minutes left, I think we should definitely hit maybe what are some of the difficulties that if somebody has received this diagnosis or they're questioning some of the difficulties that they can maybe expect.
Okay.
Kind of brace themselves.
Yes, there are different varieties of frontotemporal degeneration. There's the primary progressive aphasia that a lot of people have heard about because of Bruce Willis, and his is more of the speech and language type, and Kara's is the behavioral variant. People with behavioral variant, which is the one that I've obviously the most in tune with, is their behaviors become very childlike. First of all, they have no filter. They have no awareness of personal space. So if you're taking her to the store, I mean, she'd get right up, you know, maybe in your face. She may be intrigued by your blouse or your hair. She may decide to make a comment that might not be the most appropriate. And so those are things that happen. But as Kara progressed, the worst were the inability to do anything for herself, such as even brushing her teeth. She was unaware of those things that needed done. So we took care of her, my husband and I, for 4 years, 24 hours a day, 7 days a week. We were so blessed. She was quite a joy to have around the last year and a half. I held her hand every night when she fell asleep and sang "Jesus Loves Me" to her, like I did when she was young, and I cherish those moments. And it's not what I would have wanted, but the beauty in it was just amazing.
And before we started recording, I mean, you have shown me photos that we'll be sharing with our viewers as well, of some of the wonderful memories that even after diagnosis, you made sure to capture those. How invaluable are those now?
I'll tell you, my husband and I were going through those, and we found a little snippet of a video of him pushing her on the swing, and she is just giggling. And a lot of times they do become, you know, kind of giggle or make noises when they can't speak. And just to see and hear the joy in her, and to know that she was happy and content, and the love that she had. A lot of her friends, you know, didn't come around as much. I know it's kind of difficult when you don't understand, but the ones that did, at first they'd say, "I don't think she remembers me," but she would come up to him and then turn her cheek because she wanted a kiss.
Aww.
And she'd hold their hands. She loved to hold hands. That was extremely important to her. And they walked away with beautiful memories. They're like, "Oh, I'm so glad I came today, because Kara, I came here to see Kara, but Kara blessed me." You know, we just to know she was there and she loved him, because she had her memory till the very end. She just wasn't able to express it the way you and I do.
But you could see it in her eyes.
Oh, you could see it in her eyes, and the eye contact that she made. And that's why we say, you know, love needs no words. That's why, and you know, it's hard because our society, we really do respond to people's facial expressions, and when they're not there, it's really tough. So really getting to know somebody and look them in the eyes and know where they're coming from and see their soul is very important.
As we wrap up our time here, is there anything else that you would like to share?
I appreciate the fact that that people like you are willing to help me share this story. A lot of people say, "I don't know how you do it," and the truth of the matter is, it's therapeutic for me. It brings some purpose to the pain. And when you have children, you know, she had a lot of life ahead of her. She passed at 33. She'd been a nurse, and believe it or not, her favorite patient, she worked on an Alzheimer's unit, and she loved them and they loved her. And I just feel like this is my way to carry on her legacy. And she has a son who's going to be 7, and we just enjoy him so much. And we want this to serve others, because that's always been something in our family that we've been very strong about. And it's just a way to bring her along with it all too.
Keep her in your heart and keep her present.
Oh yes, she's in our heart every moment. And I have a lot of people who've told me, "Oh, you don't know what your story and what Kara's you know, life has been." She's our hero. So.
Well, Dawn, thank you so much for sharing your story, sharing Kara's story.
You.
It means the world that we're able to highlight this condition. And coming up next, we are going to be talking with Dr. John, Kara's doctor. So don't go anywhere. Being Well, we'll be right back.
Now on Passport.
There's an important story that needs to be told.
It's your choice.
Choose your story.
What are you looking for in your life?
Stream even more documentaries with Passport on the PBS Video app. Committed to bringing local news, weather, and sports, it's the award-winning WEIU News Watch, weekdays at 5:30.
And we're back. We're continuing our discussion on frontotemporal degeneration. We are bringing in our medical professional on this topic now. We've got Dr. Matthews John, who is here with us from Wabash Valley Psychiatry. Dr. John, thank you so much for making time for us today. We sure appreciate it.
Glad to be here, Lacey.
Yeah, so as we start this conversation, I think there might be a little bit of confusion as to what the difference is between FTD and Alzheimer's. So how are the two different?
Yeah, that's a good question to start off the discussion. Dementia describes any illness that includes problems with memory, with thought processes, with language, ability to do tasks, and can even affect your mood or behavior. The most common dementia that most people talk about is Alzheimer's dementia, and FTD, or frontotemporal dementia, is it's an umbrella term for a group of brain diseases that affect, as the term implies, the frontal and temporal lobes of the brain. So the way to think about it is it affects mostly the lobe right behind your forehead, that's a frontal lobe, and right behind your temple, that's a temporal lobe. So that's why it's called frontotemporal dementia. There's multiple differences in how they're present in cases, but the big one to remember is Alzheimer's tends to be most commonly seen in people over the age of 65, versus FTD can start presenting as early as age 40. And so you see more people between the ages of 40 to 65 who have FTD.
And I think that's very interesting to point out too. Our first guest of the program, she was referring to her daughter who happened to start showing these signs and symptoms of the condition around 29, 30 years old. And so a lot of times we typically think of Alzheimer's in the older patients. And so this is can come as a shock to a lot of family members for sure.
That's correct. One of the problems with treating and diagnosing FTD, like you pointed out, is since it happens early on, most people don't think of dementia as a diagnosis in that case. And the other interesting part about FTD is a lot of people who have FTD actually come into the office not with dementia symptoms, which is memory problems, but sometimes with behavioral problems. So that is why FTD tends to come to psychiatric offices sometimes even before they go to a neurologist, because family feels there's something psychiatric going on. And according to AFTD, the average duration of time from onset of symptoms to the diagnosis can be 3 to 5 years because of this, because we just don't suspect that this is a case of dementia.
Mm-hmm. And so as we're talking about this, you mentioned a little bit about how it does present and it can be behavioral. Maybe what other symptoms come to mind when family members can, keep an eye out for in their loved one?
Yeah, so like I said, if we think about most dementias, especially Alzheimer's dementia, it starts with memory problems. So people will say, oh, my mother or grandmother cannot balance her checkbook, she gets lost or whatever. In FTD, typically we see either patients come in where families say there's a personality change. My loved one is usually really empathic. She understands social cues, but now she's being rude. She doesn't seem to have any empathy. She doesn't pick up on social cues. Sometimes they start having compulsive behaviors, which is unusual for them. There is also a variant called the speech variant or aphasia variant, where you start seeing language problems. Again, in the absence sometimes of other memory issues. People can't either come out with words. They'll use general terms rather than using specific nouns. They'll say that thing out there rather than pointing to a pencil or a pen. They'll sometimes search for words or you have what's called telegraphic speech, which is they'll use a sentence with parts of the sentence missing. They can't form a full sentence. So these are symptoms that are typical at the time of presentation, and the family knows there's something wrong, but it's not clear what exactly is going on because of all these different symptoms in different facets of their life. What I typically ask people to do if they're concerned about it is AFTD, which is the organization that deals with frontotemporal degeneration. They have a couple of checklists on their website that's really easy for families to go through and check off and can see if there is signs of FTD or at least increase their level of suspicion. And if that comes out to even be on a borderline case, they should go into either their primary care or the neurologist or psychiatrist to get a further evaluation done.
And I think what's so tricky about this, as you talk about it, potentially presenting as other conditions, having such a hard time or a lengthy time to get it diagnosed, it can be troubling for families trying to sort through this. And I have to ask, so once someone has been diagnosed with this, what's next? Are there any sort of treatments?
Unfortunately, we currently don't have any specific treatments for frontotemporal dementias. There is obviously a lot of research going on. We know that in maybe 40% of the cases, there's a genetic etiology. So there's a lot of family and genetic research going on. But currently, all the treatments that we do is focused on symptomatic treatment. So, for example, if somebody has behavioral symptoms, and those symptoms are, say, related to compulsive behaviors, we use medicines commonly called SSRIs. These are medicines that we use for depression or obsessive compulsive disorder. We can use that for those kind of symptoms. If they have a lot of anxiety, we can use similar medications. If they have really overt agitated behaviors, disruptive behaviors, or behaviors that are putting them or other people at risk, we can use medications called atypical antipsychotics, which are kind of mood stabilizers. We can use that for symptom improvement. Obviously, as the condition progresses, especially with people who have speech pathology variant of FTD, they can develop swallowing difficulties. In fact, one of the biggest risk factors for people with FTD tends to be aspiration pneumonia, where they eat and they're not able to swallow well, and food gets into their lungs and they get pneumonia. So speech therapy is actually pretty important in these cases. So we have a lot of supportive treatments for FTD, but as said, unfortunately, we don't have any form of specific treatments for it.
And so when it comes to family members, I mean, what can caregivers do to best help out these patients who have FTD?
So number one, as I said, is to get educated as much as you can about FTD. There's a lot of online resources for it. There's online support groups, and that's where I would start. Your doctor's office can also refer you to certain places where you can get more information. So that's the first part. Like, how do I understand this condition? How can I understand the timeline? What kind of progression of symptoms am I looking at? And then what are the resources available in the area? One of the things we get concerned about, especially given the early age of onset of this condition, is caregiver stress and caregiver burnout. We want to take care of the patient, but we definitely want to make sure that the caregivers are also getting the support they need so that they can stay healthy and psychologically like they are healthy enough to take care of the primary patient. So get information, get support. and then other healthcare providers, home health care nurses, neuropsychologists. Sometimes, depending upon which center you go to, there may be genetic counselors because, as said, in 40% of the cases, this can be a genetic condition. So you want to get the family genetics identified. You can get physical occupational therapy involved. You may want somebody to come into the house and look around and say, how can we make the living environment as suitable for the patient, make it safe? Think about a person who now no longer can drive. Something as simple as making sure the car keys are not visible, because that's a cue for the patient to say, oh, let me go drive. And they don't always have the impulse control to stop it. So, keep the car keys away. These are simple things that, we may not think of as family, but somebody can look at the house and explain to you what you can do to decrease the stress on both you and the patient.
Right, and also thinking back to the first interview where we're talking about how Dawn's daughter, you could still see in the eyes sometimes the recognition of certain memories and certain interactions. And so as that starts to go away, like you say, removing those stimuli, those different things that could potentially be risks, could be incredibly important. As we are talking about this condition, I know that there's different types of it. We've mentioned in the earlier part of the interview Bruce Willis experiencing a certain type of this, Dawn Kirby's daughter experiencing a certain type of this. Overall, how common is this condition? Do you see this a lot?
I don't see a lot of this condition, and the studies are kind of all over the place when you look at prevalence rates. Part of it may be because, as I alluded to earlier, this is not a condition that is always diagnosed properly. Sometimes it's misdiagnosed as Alzheimer's. But the best studies give a range between 10 to 20% of cases of dementia between the ages of 40 to 65 are likely to be FTD, because that is when Alzheimer's dementia and stroke-related dementia is less likely, versus FTD is more likely to occur. Whereas once you get to the age of 65, and you look at people over the age of 65, most of the dementia onset after that age is going to be Alzheimer's type of dementia and less likely to be FTD. So I would say if you see a dementia before the age of 65, especially closer to that 40 cutoff, you should always be thinking FTD before you think of any other form of dementia.
And so how important is spreading the word about this condition, considering it is so often misdiagnosed, to get word out to families and to medical professionals as well?
Definitely important. As said, even though we don't have a good treatment for it, the more we spread information, more cases are going to be diagnosed early on in the illness, and we can get more research done, we can get more treatments done, we can provide more supportive care and provide help not just for the patient, but also for the family early on. So the more we can get this information out to people and to professionals in the field, I think it would definitely help society as a whole.
So just a reminder for our viewers, we're here talking with Dr. Matthews John, who's filling us in on the ins and outs of FTD. As we're in our last couple of minutes together, are there any other aspects of this condition that we've not hit that you think is valuable for people to know?
No, I think we covered most of the important areas that we need to think about when we consider the treatment and diagnosis of FTD. But the big ones that I want to go over is, again, even though the term may include dementia, this is primarily presenting with either speech problems or behavioral problems. And the typical memory problems like getting lost or seeing things or not being able to balance your checkbook or forgetting where you put your keys, those symptoms come later on. they will come, you will notice those symptoms, but they come later on. By the time those symptoms appear, the patient has had FTD possibly for 3 to 5 years. The other part I want to kind of point out, which we may not have talked about, is that the progression is different for everybody. So I have seen cases where from diagnosis to the time the person was either in a nursing home or passed away was 12 months. And I've seen other cases somebody who was diagnosed at the age of 45, and currently at 66, he's still at home and is functioning well, comes to my office every 3 months, and has not had too much of memory issues. So you can have all kinds of progression. So it's not something that as soon as you get the diagnosis, you lose all hope. You really want to get in there, get the diagnosis right, and get as much of care and treatment as you can as soon as you have the diagnosis. And the third part that I want to emphasize is all the online support and help you can get for education and supports that are available in your community.
Very well put, Dr. Matthews. John, thank you so much for being here on Being Well. You've been a light on this condition, and we sure appreciate your time here.
Thanks, Lacey. Glad to be here.
Of course. And as we head into the last portion of this episode, we will be speaking with Esther Kane from the Association for Frontotemporal Degeneration. And she will highlight, as Dr. John said, she will highlight ways that families can get connected, resources available and information, because knowledge is power, about this condition that does impact, unfortunately, so many people. So stay tuned. Being Well, we'll be right back.
That way the flavors will marry nicely.
Doesn't that look good?
There's still places to discover.
It just absorbs you.
Get here fast.
That was a new experience.
We're just getting started.
From Paris to Taylorville and places in between, City Spotlight focuses on the issues affecting Central and East Central Illinois communities. City Spotlight, Wednesdays at 7 on WEIU.
Welcome back to our Being Well special on frontotemporal degeneration. Love needs no words. I'm your host, Lacey Spence, and we are welcoming in our third guest of the program. We've got Esther Kane joining us from the Association for Frontotemporal Degeneration. Thank you so much for being with us here as we continue this discussion on AFTD.
Thank you for having me. I'm so glad to be here today.
Of course. My first question for you is really just to kind of get acquainted with how you got involved with this organization, what your title is, what your role is. Can you please fill us in?
Sure. So I actually am a registered nurse, and I have spent most of my career working in long-term care, specifically caring for those with the dementia diagnosis. So I really started out at a young age, had no idea I was going to fall into working with those with dementia, but it became a huge passion of mine very quickly. Improving quality of life, improving the way that people are cared for, managing people's lives to improve their quality of life has always been a big priority of mine. And so I started at AFTD almost 4 years ago. And my role here at AFTD is actually to oversee all of our support programs, our caregiver support programs, our education for people living with the disease, as well as for their care partners and families. And then I also oversee all of our healthcare professional education initiatives.
Wonderful. So it sounds like you wear a lot of hats. So as we start our discussion here, can you kind of talk a little bit more about the mission of the AFTD? What does it have to offer families?
Yeah. So AFTD's mission is actually to improve the quality of life of those affected with FTD and to drive research to a cure. So everything that we do is geared towards improving the lived experience and finding ways to make living with FTD better for those who are currently living with the disease.
Gotcha. So as we start talking about the resources that are available to families, can we start by talking about what is the helpline?
Yeah, so AFTD's helpline is one of the first things that was started at AFTD. AFTD was actually started by a woman named Helen Ann Comstock, who, with a $1,000 donation, started the organization. And when she started AFTD, it was really because she knew that unless there was an organization completely focused on FTD, that people were not going to get the correct care and support, and that we were never going to find a cure. And she recognized the need that the disease brings for people to have, to be able to talk to somebody who understands what they're experiencing and what the disease is. Because FTD is very different than other forms of dementia, it's a younger onset of diagnosis, as we've already heard, as well as the fact that it has different symptoms and it displays very differently. And so what families need with an FTD diagnosis is very different than what they need with a standard dementia diagnosis because of the way the disease presents and what families are faced. And so she started the helpline as a way to support these families. Today, our helpline receives, last year we received over 3,800 calls from people living with the disease, healthcare professionals, care partners, family, friends, really just reaching out, trying to better understand the disease, finding resources, finding support groups, trying to get a diagnosis, just to name a few of the things that our helpline provides. Currently, today, our helpline is staffed by 3 social workers, and really all they do is FTD. They know FTD well. All of them have come from a clinical background, so they understand how to access support with finances, how to access resources, how to find long-term care if it's needed, how to find support in the home, how to manage difficult behaviors, and all of the things that are associated with the disease. And so, that's the AFTD helpline, and they do great work.
And the easiest way to find that, is that by going to the aftd.org?
Yeah, you can actually call. So the helpline number is 866-507-7222, or you can email at info@theaftd.org. There's also a webpage on our website that talks about the helpline with frequently asked questions that we get quite often, with immediate resources for families, as well as additional resources.
No, I think it's so great to have this so readily available, mostly because a lot of these symptoms that we've been talking about with Don Kirby and with Dr. John, they can present as other conditions. And so it's a little scary when all of these things start to combine, and folks unfortunately just need a sounding board to try and sort through this. So after covering the helpline, would also like to talk about the webinars that are available on the website. Those are a wealth of knowledge as well. Kind of talk us through that.
Yes, we have many different types of webinars, whether it's focused on understanding research and what's happening in the research space, whether you want to learn more about the disease or understanding exactly what it is that you're dealing with, what the symptoms are. And then we have webinars on things like coping with grief and loss, how to build a care support system, managing kids and teens at home. There's a lot of really interesting information that is available on our YouTube page, and you can learn a myriad of different tactics to kind of cope and manage the disease.
Yes, definitely. So after the webinars, also meet and greets, being able to connect families to each other and kind of share in this experience. Please talk about that.
Yeah, so I think one of the things that we hear from people living with FTD and their families is it's a very isolating disease. People feel really alone, as if they're managing this all by themselves. Nobody understands what they're going through. And so what we hear so often is that when people either join a support group or go to a meet and greet, they feel as though they're in a room with people who actually understand what it is that they're dealing with and what it's like to live with FTD or to care for a family member with FTD. And so these meet and greets offer an opportunity to meet and talk and be in person with those who might live in your area, to connect, to learn about resources in your area, and sometimes just make new friends.
Yes, and so as far as locating meet and greets, are they something that's spread throughout the United States? Are they kind of localized? Do I need to travel?
So our meet and greets are actually done by volunteers. And so if you're interested in volunteering with AFTD, you can go to our website and you can sign up to be an AFTD volunteer. But very often the volunteers, depending on where they live, will decide to host a meet and greet in their community. And then they can get that all set up. So they vary from place to place. It really depends on people being willing to host and to set up the event. But they happen all over the country. Sometimes they're virtual, very often they're in person. And it really creates an opportunity to connect. So if you're interested in joining a meet and greet, I recommend that you join us on social media. So AFTD has a Facebook group, a Instagram account, as well as a Twitter account. We're on TikTok, LinkedIn. But join us and follow us on social media, and you'll be notified of meet and greets that are happening maybe in your area. In addition, if you sign up with AFTD to any of our newsletters or join our database, when there is a meet and greet happening in your area, you'll be notified via email that there is a meet and greet happening in your area. And in addition, you can join our website or always reach out to the helpline. They're aware of what's happening in your community, and they can guide you if there's a meet and greet available.
And gaining information, gaining attention around this condition obviously is going to help with raising funds and promoting research. In recent months, there's been a case that's kind of gotten some notoriety, if you will, with Bruce Willis being impacted by the condition. As I understand, I think there might be a story about this on your website as well.
Yep, if you go to our website, there's some information about his family, talking about what it was like and his diagnosis. If you go to our YouTube page also, there's some interviews with the family that you can see and watch to learn more about that experience. But raising awareness is so important. And it's not just one person's diagnosis. FTD affects so many families and so many people in this country. And very often it's a misunderstood and underdiagnosed condition. And so these families are struggling with getting an accurate diagnosis, the financial and emotional toll that the disease brings with little understanding. And I think the greatest gain from awareness is that people we're reducing stigma, and we are allowing people to understand what's happening. This isn't just somebody acting inappropriately or weird behaviors. This isn't somebody who's just not speaking well. This is actually a neurodegenerative disease that's occurring, and we need to walk with families with compassion and grace.
No, most definitely. And so as we're talking about this condition, and it unfortunately does impact younger and younger in persons with it, can you talk a little bit about financial planning and legal planning as families are finding out this diagnosis possibly in a loved one or in themselves?
Yeah. One of the things that's so hard about FTD is its younger onset diagnosis. So very often people are still working, or they're in the beginnings of their career or early parts of their career. So versus getting a diagnosis like this in your 90s, where you might have a little bit of a retirement stash put away to help pay for long-term care services or other things, very often these families are just hit out of nowhere with these new financial costs. AFTD actually participated in a study in 2017. And what they looked at was the economic burden of somebody living with FTD. And what they really found is that the economic burden and the economic cost to families is almost double that of Alzheimer's disease.
Wow.
And so correct financial planning and legal planning is so important. Another thing that happens quite often is that people end up having job transition. So very often we say some of the first symptoms or the first things that families notice is that they get fired from their jobs unexpectedly. This really great worker, he's had a great career. All of a sudden, they're making all these mistakes or things are happening. So very often in the workforce, that's the first place that some of these symptoms are identified. And then families are surprised as to what's happening. This isn't like mom, this isn't like dad, this isn't like my husband. I don't understand what's going on.
Right.
And then as they learn more, they're trying to navigate and figure that out. So trying to transition from jobs is really difficult. It's really important that you talk to your HR, that if you're starting to see symptoms that you get FMLA, you put those protections in place for yourself during the process so that you are able to take advantage of whatever resources or supports are available during that transition, whether it's long-term disability or short-term disability or whatever you need to be able to manage the disease. In addition, it's really important that we look at things like getting a power of attorney, medical, financial power of attorney, and having discussions with your family after a diagnosis. You know, do you want doing your living will, talking about end of life directives and how you want to be treated and what you value and what that looks like for you. So there's a lot of really important things that you need to consider. The other aspect that we always want to talk about is that FTD, unlike other forms of dementia, about 20% of the time is actually caused by a genetic, a gene mutation or a gene variant. And these genes that cause FTD can make it a little bit more complicated for families. So we also recommend that you look into long-term care insurance as soon as possible, especially if you're going to undergo genetic testing. You want to get those things in place before you undergo that testing to understand what's happening. So there's a lot of information on our website about legal and financial planning. And as always, our helpline is here to answer questions and offer support if you're in a particular situation.
Yes. No, thank you for walking through those options. It definitely can be challenging to think about, especially as a younger person. So as we have definitely covered a lot of the patient side of things and family side of things, we keep coming back to this. It takes a while to get this diagnosis. Many medical professionals maybe haven't even heard of this condition. So how does the AFTD work toward educating not just families, but medical professionals as well?
Now, so the average time to diagnosis of FTD is about 3.5 years. And it's very often misdiagnosed as another form of dementia, bipolar disorder, adult onset schizophrenia, or just blanket dementia with no further information provided to the families. So what ends up happening is that there's gaps of knowledge that are happening among healthcare professionals. And so we have a couple initiatives that we have trying to educate healthcare professionals, whether you're people providing care and support, nurses, social workers, those people in the community, occupational therapists, speech therapists, or your doctors, nurse practitioners, physician's assistants, and neurologists. We really aim to try to provide education so that you can better diagnose the disease and improve care and support. Some of the ways that we go about doing that is that we do webinars. We have a CME CEU program where we offer webinars. We just had one on diagnosing FTD ALS that's available on our website. In addition, we have ongoing e-newsletter called Partners in FTD Care. And this e-newsletter serves to be able to provide education. If you go to our website, you actually can see over 30 editions tackling various issues, how to transition somebody to long-term care, how to manage difficult behaviors, compulsive behaviors, anosognosia, which is a very common symptom of FTD, where the person just doesn't realize they have anything happening, even though there's deficits that are occurring. And so these partners in care are great tools for both people working in the care and support side, as well as diagnosers and detectors of the disease.
Gotcha. So looking to the future, what would be the ultimate goal that the AFTD could achieve?
I think we're all working towards a cure, right?
Absolutely.
So we would be able to have a cure for those who are diagnosed with FTD, so that nobody has to live with this diagnosis. But until there's a cure, there's care. And we want to make sure that people are getting appropriate care, that there's evidence-based practice happening where we understand how to approach symptoms, treatments that can help families manage the disease and people living with the disease have the best quality of life that they can. So when AFTD's mission says that we are working towards a world of improved quality of life of people living with FTD and a cure, that is everything that we are working towards. And we're not going to stop till we get there.
Right. And so what is maybe a tangible or practical way that if somebody is looking to give back or get involved, how can they do so?
I think everybody's different, and so there's a lot of ways people can give back. One of them is to advocate in your state. AFTD has a growing advocacy program where we are working with local legislators to get FTD awareness weeks approved and being held. We've had them done in New York and California, and we just had one approved in Delaware. It's raising awareness in the communities and helping legislators understand what these families are facing every single day. You can volunteer, whether you want to run a support group, if you want to do awareness activities, if you want to, present or do table settings. There are so many ways people can volunteer with AFTD. Some people do fundraising activities for us. They volunteer to do fundraising activities. So we have campaigns like we currently have right now called Food for Thought, where people will hold an event. Usually there's some kind of food associated with it. And then they'll talk about FTD and raise awareness in addition to that. And so these Food for Thought activities happen throughout the country, and we really work to have one in every state so that every state has a representative who's really raising awareness for the disease, as well as raising funds to help support our mission and our goals. And those are just some of the ways that people can get involved and engage with us. Obviously, if you want to get involved, go to our volunteer site and sign up. And we'll see. I mean, people have really creative ways that they want to be able to engage and kind of support our mission and support the community.
Right, and like you said, it's not just up to one person. So as we're in our last couple of minutes here, is there anything about the organization or about the condition that we haven't hit on that you think is important for people to know?
Yeah, I think the biggest thing I always want people to know is that FTD is not like other forms of dementia. Just because you hear dementia does not mean that it's going to correlate with what FTD is. So understanding the differences of this diagnosis and what these families are facing is so important to improving what their life looks like moving forward. I think also just to let you guys know of some other resources and information we have, AFD does have a ComStat grant program, which offers modest financial assistance to people living with the disease as well as care partners. You can apply for these grants on our website, and they're specifically designed to support those who are living with the disease and trying to find ways to bring a little bit of joy into their everyday. In addition, I would also say that AFTD has a vast support group network. So if you are diagnosed with FTD, you are not alone. There are people throughout the country who want to walk alongside you and to be a support for you. You can learn more about AFTD support programs on our website. And in addition, I think it's really important if people want to get engaged, AFTD partners strongly with the FTD Disorders Registry. And the FTD Disorders Registry is a research registry that works to help to galvanize the community to drive research towards a cure. And you can learn more about that information also on our website, or you can go to ftddr.org and learn more about the FTD Disorders Registry.
Excellent. You've summed that up so nicely. Esther Kane, thank you so much for coming on this Being Well special. We sure appreciate your time.
You're welcome. Thank you for having me.
Of course, and we thank our viewers for joining us for this special on frontotemporal degeneration. We hope that this has helped illuminate this condition and give it a voice and spread awareness. We hope that you will join us for our other episodes of Being Well, and in the meantime, if you'd like to watch this episode again, you can find it on our YouTube channel. Thank you for joining us, and have a good night.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.